Welcome back to the Code Guys. Dr. Andrew Fix with Physio Room, host and founder of this podcast. On today's conversation, I had the opportunity to sit down with Kwame Terra. He's the CEO and founder of bEHR, a digital health platform built to improve the health in the Black community and ultimately to help raise the bar for all of us. Like many of you guys listening, he grew up in a family of runners, went on to run collegiately, and later he earned his master's in public health with a focus on what's called health equity. Our conversation is one that really sits right at the intersection of performance, prevention, and purpose. The app bEHR just officially launched both on the Apple App Store, Google Play Store. In this episode, we'll talk about what bEHR stands for, Black Electronic Health Record, how the app uses a real-time health score to help people understand where their health is today and how to move it in the right direction going forward. We dig into things like the 6-year life expectancy gap between the Black community and the rest of the population, the role of social determinants of health, and why things like health literacy and prevention matter just as much, if not more, than any treatment plan. We talked about the power of something as simple and accessible as walking. Kwame actually set the world record for most steps in a month, logging about 2 million steps, which, if you can imagine this, is over 60,000 steps a day, and how that challenge has sparked a movement inside the bEHR Health community, including their Million Steps Challenge and their upcoming bEHR Health to the Moon campaign. If you care about taking ownership of your health, building healthier communities, and being inspired to move more, you're going to get a lot out of this one. Let's dive into the conversation with Kwame Terra. Thanks for listening. Kwame, thanks for joining me, man, here on the Code. I really appreciate getting the chance to talk with you. How you doing today?
I'm doing well, actually. It's actually a very, very good day for us. We are officially live in both the Apple App Store and the Android Google Play Store with the bEHR Health app. So something
Yeah,
I've been
you were.
working on for the past 3 years. So
Yeah, I mean, when something that you've been working on for a long time finally comes to fruition, that's a really good feeling. You were just telling me off air that your guys' app officially launched today, so congratulations on that.
yeah,
I
thank you.
think it's pretty ironic that we were just saying how we had to reschedule this podcast. We planned this date a few months ago, and it just happens to coincide with the same day that you guys
Yep.
officially launched that. Um, in the app marketplace. So that's pretty cool. Will you do a quick introduction for us? Tell myself, the listeners, a little bit more about you. We know that you are currently holding the world record for most steps in a month. So I want to get to that story. It's pretty impressive. And then we'll get into talking about what the bEHR Health app is, why it's important, but yeah, tell us more about you.
Yeah, sure. I'm Kwame Terra, CEO and founder of bEHR Health. I was born here in New Orleans, Louisiana, but I grew up in Houston, Texas. Grew up in a family of runners. Myself, my younger brother, my younger sister, and my oldest brother all ran. Well, three of us ran on the collegiate level. One of us, or the other one, could have, but he ultimately decided not to go to college. And so just grew up in a culture of, I would say, more or less health consciousness in my household. So my dad made sure that we ate healthy foods growing up, just conscious of the things that we put in our bodies. So I guess that would probably be where my focus on health started, or just my awareness of health in general started. And then I went on to Xavier University of Louisiana, where I ran track and cross country and studied pre-med, got introduced to research early on and started developing appreciation for addressing things from the root cause of the issue. So as opposed to being a physician, not that, physicians can't do both. I wanted to build something that focused more so on the preventative side of things. And eventually I ended up doing a master's of public health with a concentration in health equity. And ultimately that's where I came up with the idea for bEHR Health. And ultimately our vision is to create a real-time database of health data in the Black community so that we can, well, first and foremost, understand where everybody is and how everyone is doing,
Mhm.
and then identify solutions that are most effective.
Man, you're speaking my language here with the prevention, the root cause treatment, rather than, just addressing symptoms of things. We've talked about that topic or that overarching theme so much on this podcast. And, our medical system here in the United States, as people that are listeners to this show know, is set up to treat treat issues that we have, right? But
Mhm.
is it set up to prevent those issues in the first place? Not really. It's really
Yeah.
not set up like that. We have the we have the knowledge and the skills to be able to do those things, but that doesn't necessarily mean it's easy. Like the solutions and the prevention things, like they might be simple, but that doesn't make them easy
Right.
because our world is not necessarily set up to make it that that's like the natural course of things. So I think it's so cool to hear you say that, and just like you, I ran cross country, or I didn't run cross country. I ran cross country growing up, but I ran track in college as well. What events did you run?
1500 and up.
Yeah, the little longer stuff. So
Yeah.
the opposite of me. I was running the shorter things.
Yeah.
But yeah, it's out here in the Colorado area where I'm sitting, running is so prevalent. There's tons of people running trails, ultra marathons, you name it. But not that you have to necessarily do that to be healthy. Um, So, Bear Health app. Tell us a little bit more. You started to tell us about like, where the idea came from when you were going through your studies in your master's program and whatnot. But um, what does Bear stand for? And then if someone was going to download or use this app, what does that app help you do?
Yeah. Yeah, great question. I left out one part of the story that ultimately led to me starting this company and well, really just trying to solve the problem. My aunt during the COVID-19 pandemic, she's a physician's assistant, and she texted me and said, "Hey, nephew, I think this would be a great time for you to kick off your healthy eating initiative again. The disparities are at the forefront. I think it should be focusing, primarily on the Black community, although everyone, could benefit from it. But yeah, now is a better time than ever to because everyone's paying attention and everyone is scared of what happens when they don't take care of themselves. As the virus is preying on the most, compromised among us. And so that message was actually the seed of Bear Health.
Mm,
And this is ultimately what I came up with. So BEHR actually stands for Black Electronic Health Record. So if you're familiar with the medical system, healthcare system, you're familiar with electronic health records, electronic medical records. Originally, we were actually going to go with bEHR, so Black Electronic Medical Record. I figured
yeah.
we'd run into some issues with BMW and with that name and also it's we're doing more than medicine with Bear Health, and so that's why we ultimately went with um, Black Electronic Health Record. And so
Mm,
my first goal was to communicate clearly to the Black community our current health status. So 60% of Black people have low health literacy. Most of us aren't aware of our current health status or the short and long-term implications of our lifestyles, and the consequences that obviously come with that. And so my first thought was like, how do I communicate that clearly in a way that we all can understand and connect to, and then also it live with us? So I didn't want to just host like a webinar series where someone comes and they get educated for an hour and then they're excited for a couple of weeks and then they kind of fall off.
hmm
And health is complex. It's hard to know how healthy you are exactly. And the number really helps at least people be able to understand it a bit more, even if it doesn't necessarily tell the whole story. It helps people understand if it's good or bad, if it's heading in the right direction or not. And so the cool thing about the score is that as you change, so does your score. So when you first download the app, you complete an initial health score assessment. You'll get a number between 0 and 1,000 that represents your overall health. But that's just a snapshot based on some questions that you answered. However, our app integrates with Fitbit, Garmin, Apple Health, Google Fit, Samsung Health, pretty much any tracker. And so day to day, week to week, as you live your life and as your life changes, so does your score. So if you go on a run or a walk one day, your score is going to go up a few points. If
hmm
you're inactive for a couple of weeks, your score is going to go down. And based on those changes, we'll make recommendations for how you can improve, as well as connect you to healthcare providers, resources, and experiences
mm,
to help elevate that score, right? And over time, as more and more people are on the platform, we can get pretty predictive with that score. So, for example, if you come on the app and your first health score is like a 375, well, we've seen other people that have a 375 also have type 2 diabetes or also have, early stage heart disease or so on and so forth. And so we'll let them know, hey, you may be at risk for this condition based on your score. We highly recommend that you go see a provider to get some testing done to see where you are. And so again, First step is make people aware of their current health status and then connect them with solutions
Yeah.
off the platform.
Yeah, I love that. And I totally agree. I love the phrase, what gets measured gets managed. Or, what you measure you can improve or something
Yeah,
along
you can't
along
improve what you aren't measuring.
yeah, exactly. So having the number, having the score, something, you know, I'm a big sports person as well. And people
Yep.
generally don't play sports without a scoreboard there. And the scoreboard makes you pay attention and it makes you
Mhm.
put more effort into it. If there wasn't a scoreboard, then fans and stadiums wouldn't be full of watching it if there was no scoreboard
Right.
because then it's like, what's the outcome? Well, having that
Mhm.
score and having it be something that can change and evolve with you for better, and I don't necessarily want to say for worse, but it will ebb and flow. It can go up and down based on
Mhm.
how you're living your life and the seasons that you're going through. I
Yep.
think that's a really cool idea. And then I didn't even know about the part that you just mentioned, how the connecting with resources,
Mhm.
connecting with providers and opportunities and things to provide people that are using the app with things that can help them in their health journey. I think that's a great tool.
Yep. Yeah, so that's the solution for the individual, right? So I like to say real-time health education for individuals.
Hmm.
Um, what I learned in the master's program, again, it was a master's of public health with a concentration in health equity, is that the majority of what's driving health disparities in the US, really around the world, are what are called social determinants of health, right? So
Hmm.
these are the environmental factors like quality of housing, quality of neighborhood, access to healthy foods, access to health care. These are the things that are really driving the disparities that have created this life expectancy gap that exists between Black people and the rest of the population, which is about a 6 year gap. Average life expectancy in the Black community, 72 years, rest of the population, about 78. And that might not sound like that much when you're living 72 years or 78 years, but if you extrapolate that across the entire population, we're looking at like about 268 million years of lost time in the Black community, driven primarily by premature death caused by chronic conditions
Yeah.
that we develop early. And so um, that's really what was kind of explained and what I learned ultimately in my master's program. And part of what has influenced one unique feature of Bear Health, which is in addition to the real-time health education for individuals, we create what we call the health score report, which is a essentially a monthly report of the aggregate data within the app in a given region. So, for example, we've only been operating in New Orleans so far on our beta app up until now. And each month we look at the average health score overall, the average health score by age, average health score by gender, average health score by the 7 categories of health that we track. So we track physical health or medical health, nutrition, mindfulness, sleep, mental well-being, substance use or self-control, so on and so forth. And you get a score in each category. And so now we're able to kind of look, take a step back, more bird's eye view on the entire community and identify what the trends are so that we can use that to inform and drive messaging, influence policy, because we'll start to see like there are pockets around the country where Black people are actually doing well,
Mm.
right? Despite the conditions. I think there's actually one in Colorado, I think has an average life expectancy in the 80s or 90s, a
Wow.
Black community. I forget where it was, but those things will start to emerge. We'll start to see those trends and be able to go to that community, talk to those people, learn from them, and then apply some of those practices, policies, and beliefs um, to to help communities that aren't doing as well.
Yeah, I mean, isn't that what you always want to do, right? Is you want to find the people that are doing the things or in the position or places that you want to be and go see what they're doing. And
Yep.
how can you be like a sponge and absorb the good things that they're doing and make those little incremental changes in your life or your business or your fitness or like whatever it is. Put yourself around the people that are in the place where you want to be, and how can you start to become more like them in a,
Yeah.
not that it's about comparing ourselves to other people, but
Yeah.
you don't always want to be the smartest person in the room. You usually don't
Right.
want you don't want to be that person
Yeah.
usually.
I mean, that's you make a good point, and honestly, that is what I've determined to be the solution to the problem. And not to jump ahead because I'm sure we're going to get into more details about kind of some of the work we've been doing here. But getting around other people who are either on the same journey
Hmm.
as you health wise or already in that position, you again, like you're saying, you can borrow from their energy, borrow from their perspective. You almost feel obligated to become
Yeah.
better just to be around them more. And community right now is the main driver for most people because we're so isolated and alone in different ways. And so people are doing things that they hate just to be around other people, like running. People hate
Yeah,
running.
totally. I saw, right before we hit record, I think you had like erased some things on the whiteboard right there.
Hmm.
There was like a run club, something up
Yeah.
there. I mean, they're
Yep.
continuing to grow like crazy around us here
Hmm.
in the Denver area. There's tons of people that run, but like run clubs are continuing to become more and more and more popular social opportunities for people to get together with other people that want to do similar activities. But running's one of those things that maybe right off the bat, people don't love it.
Yeah.
It just all depends on what you did growing up. But if you haven't already been into running, most people don't like it right away.
Yeah.
But then you get around the right group of people, the energy's there, the consistency and accountability is there. It starts to grow
Hmm.
upon you.
Yeah.
I don't want to gloss over some of the stuff that you said because I think this is so important. And maybe you have some more of these statistics to show or to share. I mean, you mentioned that right now the data tells us there's about a 6 year life expectancy gap from the Black community to the rest of the population, about 72 years to 78 years. And if you extrapolate that across the entire population, it's like hundreds of millions of years worth of lost lifetime.
Yeah.
And I think that is such a big deal because even if you're just boiling that down and thinking about like one individual, right? Like anybody listening to this, could you imagine if someone that you love or yourself, if your life was cut short by 6 years compared to what it could have or should have been? That's so much time and impact that you could have left, or so much
Hmm.
more of a legacy that you could have imparted on your family, and or like whatever it is. There's so much more involvement you could have had with grandchildren or like whatever that might be. So I think that is such a big deal. And obviously, you have a lot of passion behind this project and have put a ton of time into bringing it to life. You mentioned that the Black community has a 60% have like a low health literacy. What about some of these other statistics? Things like type 2 diabetes, things like cardiovascular disease. How do we see that, like these preventable health things that you're sort of talking about,
Hmm.
utilizing a tool like the Bear Health app to help improve the rates of people that have and deal with these conditions? How do we see those things when we compare how much they affect the Black community compared to how much they affect population
Yeah.
as a whole?
Yeah. Yeah, just to start, the American population in general is just trending,
Not
toward
good.
these conditions, right?
Yeah.
It's I I think I read once that like 1 in 3 Americans, or we're on track to have 1 in 3 Americans be pre-diabetic or
Mhm.
diabetic. I forget the year that will hit that mark, but
Probably
it
not
it
that far from now.
it's affecting us. It's affecting us all. However, generally speaking, the rates are about 1.5 to 3 times greater in the Black community, and the outcomes are typically more severe, right? So, um, I like we said, everyone is developing these conditions, but the rates at which Black people are developing them are higher, and then ultimately, a heart attack or a diabetes episode could take us out more likely than than uh, than someone else in other populations, just based on the data that we see.
Yeah, and you said that much of that is due to information, access, and availability of either healthcare resources, healthy food options. What are some
Mhm.
of the other things that lead to that type of a disparity or that type of a
Yeah,
1.5 to 3 times greater
yeah,
risk or likelihood to deal with that?
yeah. I mean, health outcomes are a measure, I think, of quality of life, generally speaking.
Hmm.
And when you look back at our history in the country, you know, Black people have had it hard for the majority of the time. It was almost illegal for us to have a good life for the majority of the time that we've been here. And so it's difficult to like pinpoint, how much
Right.
each attack
Yeah.
had an effect on certain health outcomes, but just like, the general halo effect of all of the policies, practices, and beliefs that um, you know, yeah, Black people had to be were exposed to. Yeah, it just created this gap in quality of life.
Yep.
So, for example, and this is the most significant statistic I think that exists as it relates to just injustice. In a documentary called The 13th, I don't know if you've seen it, but you should check it out. It's about the 13th Amendment. And one in three Black men at the time of this film, or they're based on the research from this film, have a felony conviction.
Hmm.
Now, and they're therefore ultimately, were imprisoned for some period of time, and the impact that that has on, right, family structure, for example,
Yeah, definitely.
and then the residual effect that that has on relationships being formed moving forward, just because now we lack models for a home, what a ideal relationship looks like, what a long-term family relationship looks like. And then again, it's hard to calculate all this, but ultimately it leads to lack of stability and ultimately a tough life, which comes with stress, which is really affecting all of these conditions, right? So
Hmm.
sure, you're not eating right, sure, you're not exercising enough, but stress, even if you're doing all of that, can be overpowering.
Hmm.
You're not sleeping as much because you're having to work two jobs to make a living because your father was in jail, and so you got caught up in some stuff early on in your life because you didn't have guidance, and then so now you can only get this type of job, and so it's just, again, there's so many direct and indirect effects of our experience here, and so ultimately, yeah, but ultimately it comes down to quality of life. And that's what must be restored or granted for the first time if we were to see a closing of that life expectancy gap.
Yeah. Yeah. Well, I appreciate you kind of unpacking that a bit for us because it all makes perfect sense, right? Like you said, these are things that are like hard to quantify and calculate the direct impact that each of these pieces plays in the larger puzzle. But but as you sort of like lay out that scenario, it all makes sense. And now we have two young kids. We've got a toddler and now a newborn. And that's like exactly what my wife and I are talking about, right? How can we model the behavior and the relationships that we want to try to pass on to them?
Mhm.
And, how can, as they grow up, how can we treat them in a certain way so that they come to expect and look for in relationships other people that will treat them the same way?
Mhm.
You know, we were just talking about, like cell phone use and stuff. And, if our daughter is talking to a boy years from now, like, well, we want him to be able to give her his undivided attention, not be staring at his phone when she's trying to have a conversation with him, right? But I need to model that so that she comes to
Right.
expect that that's how a guy should treat her and the type of activity. So, and it's the same thing from a physical activity standpoint. If no matter what color of your skin, right? If you don't have models in your life that are showing you how to live a healthful life, exercise, eat a certain way, take care of yourself, then you're not going to do that. Or the likelihood of you doing that just
Right.
goes significantly down because you're going to this whole nature versus nurture conversation and like what your environment is really plays a role in what's likely for you to become. So yeah, the more we can set up our environment for success, that
Yeah.
all ultimately starts at home.
Yeah.
And yeah, it all makes good sense. So I appreciate
Yeah.
you unpacking that.
Yeah. There's one thing that you just mentioned that made me think about another. I think just like a powerful influence on part of the Black culture right now, specifically as it relates to it's like the food that we eat. So during slavery, Black people were fed more or less the scraps of the animal, scraps of everything that was eaten, right? And we had to make the most of that. And some of those, practices that we developed have continued on and almost become traditions in a sense. So if you look, especially here in the South in New Orleans, for example, like, pig's feet, chitlins. Now, not everyone is going around eating pixie, but like there's people that certainly still are. But we've carried some of the, ways that we made the most out of the tragedy with us to this day, and some of those things are killing us.
Sure.
But it's like you're going against culture by not, or by stepping away from it.
Mm.
And so there's just all these conversations that need to be had on like a deep level in the Black community. And yeah, it's obviously none of this is going to happen overnight, but it really starts with education and learning. Okay, well, why do we eat like this? Okay, we had some limitations in the past. Those limitations no longer exist, and this food is not serving us. Like
Mm.
there's a documentary called "They're Trying to Kill Us," and in one of the people that are featured, he said, we're sitting over here praying over this food that's killing us, you know? And so, yeah, there's just so much, but ultimately it's going to take a lot of different approaches and solutions to solve the problem. However, the reason that I started Bear Health was so that we can measure the trends and the trajectory based on all of the different solutions that people come up with. So, in the future, I see like almost like a health innovation, like Bear Health is a health innovation platform where people, start up different solutions throughout the world, and they leverage our platform and data set as a way to measure their impact.
Hmm.
Because again, Bear Health isn't, or the Bear Health app isn't the full solution to solving this problem.
Right.
The database may be a core tool for how we know what's working, but
Hmm.
the app itself, like not everyone's going to resonate with that,
Yeah.
you know?
Yeah. And I think you're maybe speaking to like a larger, not problem, but like the larger piece here is like in order to change some of these pieces of culture that are established, in order to change the fact that our health in this country continues to trend in a downward direction, obesity is higher, diabetes is higher, we're losing people to heart disease and preventable things at higher and higher rates. These things are going to take numerous generations to try and reverse and turn around.
Yeah.
So, I've heard, you hear this about, whether it's climate change or like whatever topic it is, people are like, well, you're not going to be here any when that, when we no longer have X, Y, and Z. So what do you care? And it's like, well, yeah, but we have to facilitate and stimulate some of this change. Otherwise, our kids, our grandkids, their kids, like life is going to
Mhm.
be very different for them and not in a good way.
Yeah.
So we need to facilitate and stimulate some of this change that can be passed on from generation to generation so we can slowly see these trends start reversing and going in the other direction.
Mhm.
But we need to start it now. So I think it's great. Um, well, I mean, let's reverse back just a little bit and talk about, you said you grew up in a family of runners,
Mhm.
and a few of you guys ran collegiately. Um, but a few months ago, you set the world record for number of steps in a month, and you were tracking your steps every single day. And you told me right before we hit record how many steps on average you were logging per day, and it just kind of like blows my mind. I don't think there's probably ever been one day that I hit one of those numbers of steps. So take us back to that story and tell us a little bit about your motivation for doing that, and
Mhm.
let's get into that story a bit.
Yeah. So the story actually starts in 2024. Uh, we had just launched the Bear Health app, or our beta app, in February of 2024, and we had done this major challenge called the Mardi Gras Steps Challenge. And so we're always trying to center health in culture in different ways seamlessly, right? So everybody's walking a lot during Mardi Gras, so why not throw a challenge on top of everybody walking, to get people to take a few extra steps,
Hmm.
during their party. And a couple of months later, I'm talking to a guy named Dr. Eric Griggs. He become a mentor of mine, and I told him I wanted to do this campaign where I raise $1 million by taking 1 million steps in 30 days. So this is last April, or well, April 2024. I'm like, this is an idea I have. Do you think you can help me? So on and so forth. So he, in May, the month after we, had that discussion, went and completed 1 million steps. So he was walking 2 hours a day in the morning, you know, get some steps throughout the day with work and whatnot, and then he'd do another 2 hour walk in the evening. and he's about 54 years old. He's a physician himself. And so he was doing about 33,000 steps per day, about 5 hours of walking per day, um, 15 miles or so. And by the end of the challenge, again, he was just doing this to help me develop a strategy, really. He ended up losing 20 pounds
Wow.
in 30 days and was taken off his blood pressure medication. So what started off as this campaign idea to, again, raise money and awareness for Bear Health changed this man's life, and he's kept the weight off since, right? And he's now he's walking has become almost a part of his identity.
Hmm.
And that's been a significant benefit for him and people around him, right? Tons of people have come onto our app as a result of his story and transforming their health through walking. Now
Yeah.
it's kind of funny. I never really looked at walking really as a exercise tool, right? Especially coming from collegiate running. But I'm so glad that it's that powerful because it's so accessible.
Yeah. Right.
Um, the following month, June 2024, I did the 1 million steps in 30 days. Another user who had gotten third place in the Mardi Gras Steps Challenge reached out to me during June and was like, "Hey, do you guys have any more challenges coming up? Even if they don't have an incentive or something." And I said, "Well, do you want to try to do 1 million steps in a month?" He said, "Why not?" And so he did it in 28 days. He lost 28 pounds. He's a bigger guy. Two more users did it in August, another one in October. And so we all just got to talking about, hey, what do y'all think the world record is? And do you think any of us can break it? So it really started with this movement of 1 million steps that ultimately led to us thinking about, or yeah, one of us breaking the world record. And March, the last week of March, I was at a conference and they were talking about like influencer marketing and like influencer business models where you just like build up this profile and then you can, build and sell multiple businesses from that distribution. And I was like, well, how can I raise some awareness for myself, like build up my profile in a way that aligns with what I'm doing? Because I don't want to just go do something crazy because you can get famous for anything, right?
Hmm.
And yeah, so 3 days before April, I decided I was going to go after it. And so April 1st, 67,000 steps, 31 and a half miles. It was funny, so I had underestimated how long it would take me. When I had done the math originally, I was just doing it based on, the math from the 1 million steps, right? So I was walking about 5 hours a day. So I'm just going to have to walk 10 hours a day,
You're
you
right.
know?
Right.
And I don't know what went wrong either. I wasn't walking fast enough or what have you, but my shortest day was like 12 hours.
Okay. Yeah.
Yeah. But my first day was probably like 14. I don't know exactly. I just wasn't. I was like, I know I have a long journey. Let me pace myself. But yeah, I started off walking at like 5 a.m., did about an hour and a half. Then I drove to the track because I was coaching some people in my run club, and I was just walking around the track as I'm coaching, like yelling from different parts of the track. Normally, I'm like standing at the start.
Right. Right.
And then I go to the university where my office is, make sure everything's good there. Then I go to the fitness center and walk around the indoor track there. And then once, the workday was over, I just walked downtown, walked to a friend's house, friend walked with me for a couple hours. I ended up finishing the first day walking around the island of my friend's apartment. I was like, this is too much. Like what, how am I going to do this for 30 days? But woke up the next morning and got right back to it.
Man, yeah, I love it. And the thought of somebody listening to this saying like, "Well, how did you have the time to walk for 12 to 14 hours a day?" Of course, you were doing this for a reason, right? Like you were doing this to try to like build awareness for a project that you've been working on for years. Um, I think it's just amazing though. So you said that you were averaging somewhere between like 67 and what, 72,000 steps per day over those 30
Mhm.
days?
Yeah, mo most of my days were about 67,000.
Yeah, that's
Yeah.
impressive. I mean, I guess it does make sense though that it took you a little bit more time rather than just doubling what you were doing for the 1 million steps in the month, because there's fatigue and everything that sets in with that. It's like I don't know. I was using the example. This is totally different, but like I was using the example with someone earlier this week in the clinic. We were talking about squatting or bench pressing or some bench pressing, and you can't just take the weight that you have on the barbell and then switch to dumbbell bench press, and all of a sudden you're just assuming you're going to be able to use half of the weight in each hand, there's a lot
Mhm.
more stability requirements and things that come along with those dumbbells. The shoulder has a lot more stability to create.
Mhm.
You're not going to be able to do that. You're usually going to have to go less than half of the barbell weight in each hand in your dumbbell. And it's, the same thing when you start adding on more and more steps or more and more time that you're going to have to do. There's fatigue that sets in. Our body has a lot more work that it has to do. The physical therapist in me really wants to know, like, how did your body physically hold up during that month? What sort of like aches and pains and things did you start
Mhm.
to have to deal with?
Yeah, the first 5 days were brutal. I mean, I learned about new parts of my body for
Hmm.
sure from everything that was hurting. In particular, the inner part of my knees. So I
Yeah.
guess this tendon, yeah, just like right on like the back inner part of your knee, both sides absolutely tight. Just anytime I extended it and contracted it, just felt like I guess rubber rubbing.
Hmm.
It wasn't too painful, but it just was it was so uncomfortable. But and that was just after day one.
Yeah.
Then that continued for the next 6 days. And I don't know what I ultimately done to kind of like loosen that up. But I started doing a half a mile jog before I started walking.
Mm.
Because running you get a lot of like rotation. And so
Right.
you stay a bit looser. Walking every step you're straight legged, more or less.
Yeah. Right when the foot hits the ground. Yeah.
Yeah, and so I think that just created so much tightness for me.
Mm.
And again, I wasn't super prepared for this.
Right.
Like I had decided 3 days before that I was going to do it. And once I was in it, like I was just focusing on getting steps in. You know, I have a friend who does like stretching and massage. He's like a personal trainer, so on and so forth. And I was supposed to, like be locked in with him and getting some stuff done, but I didn't get a massage or anything until maybe like
A
day
few weeks in.
14.
Yeah.
Yeah, yeah, yeah. Because I was just like, I just got to get these steps in. I also wasn't fueling properly. Again, not super prepared, and I already eat, in a time restricted manner
Yeah.
on a daily basis, and so I'm rarely hungry, right? So even when I was doing the steps, I didn't feel hungry, right? Because you're
Uh-huh.
familiar with the hormone ghrelin,
Yeah.
and
Hmm.
yeah, right. So how it's released based on your eating schedule. So even though I was burning a bunch of energy, I was burning probably like I think it was like 3,000 a day
Yeah.
just from walking, maybe a little more. And so obviously my body needed more energy, but well, one, I had to walk. I didn't really have that much time to eat, and two, I just wasn't feeling hungry. Now, every time I sat down to eat, I could eat forever, you know.
Yeah.
So about I started experiencing sharp pains in my head. 'Cause that was the only thing that was the first thing that really concerned me because even when I was like laying down at night, I was still experiencing those sharp pains.
Mm.
And I mean, I didn't want to go to sleep with sharp pains in my head and, you know,
Right.
maybe not wake up. So I um I started hydrating a lot more for sure. And people
Yeah.
started bringing me food. And that way it kind of simplified the process. I could stay focused on walking. And I was still working on my phone while I was walking, especially the first like 3 weeks. Once it became crunch time, I ultimately like locked in and actually I don't even know if it was crunch time. I was just tired.
Yeah. I can imagine that you were tired.
Yeah.
Um, what about now I'm a big shoe nerd.
Mhm.
Were you rotating through different pairs of shoes doing this? Did you mostly use
Yeah.
the same pair until they got too
Yeah.
worn out, or how were you managing that?
Yeah. So I covered about 900 miles. So technically I should have gone through a few, or well, at least one to two
One
pair.
switch, yeah.
Um, but I was walking, so it's not as much impact. I started off with one pair of shoes and I guess it was like the first day, so I assumed it was going to hurt regardless. So I wasn't sure if it was the shoes or not. And then I ended up in another pair the next day. So I started off in some Adidas. I think the second day I was in a pair of New Balance, and then I switched to my final pair of New Balance. And I'm actually not going to name the model
Yeah.
because I need New Balance to reach out to me so that we can do a deal with the model. But ultimately, I landed on a pair of New Balances
Yeah,
that
cool.
and that carried me through the whole time. I mean, it felt like comparatively, yeah, it just wasn't as much wear and tear on my legs through the walking when I was in these shoes versus the Adidas or the other pair of New Balances I was in.
Yeah, yeah, that's great. I think, I'm just trying to think about like, and there might have been times in years past that with being younger when I wasn't wearing a watch that was tracking steps and stuff, like who knows, I might have accumulated some really, really high number. But at least in the past few years, I think some of the days where I accumulated the most amount of steps was on a trip my wife and I took to Europe.
Yep.
We were in Portugal and in Spain, and um, I remember there was like, and it's still even only just more similar to back when you were doing like the 33,000 steps a day
Mhm.
earlier in the year, but or last year, I should say. Um, but yeah, I think we accumulated, 30,000 steps or something a few different days in Europe. And yeah, I mean, man, my feet, my legs were so sore because that's not what I was doing. I was getting, more about like 10,000 steps a day or something like that.
Mhm.
I actually just released a couple weeks ago a podcast episode on here that was like the power of 7,000 steps a day and how like some of our health markers will improve in the rates of having things like type 2 diabetes and whatnot go down when we're at least accomplishing 7,000 steps a day. And I like what you said that, compared to other things, walking for most people, of course, there's some that it's not, but for many people, walking is a very accessible thing that doesn't require a bunch of equipment, doesn't require a place that you need to go to, a gym or something like that. So as long as, well, and it doesn't even necessarily require a pair of shoes, right? I mean, many people walk around without shoes on, but for the
Yeah.
most part, most people, you get a pair of shoes on and you can go walk. So I think seeing some of the impact of that, like the positive health changes that those other couple people you mentioned, like the loss
Mhm.
of pounds that they had over that month of doing that, staying off of blood pressure medication, keeping that weight off, I think is so huge. Were there any major differences that you noticed within yourself going through those few months where you accumulated that high number of steps?
Yeah. So when I did the 1 million steps in June of 2024, my resting heart rate got down to like 42 beats per minute. It
Yeah,
hadn't been
yeah.
that low since I was an athlete. And that was probably what stood out the most to me, right? Because I didn't lose much weight in doing that challenge of 1 million steps myself. Um, but what I did notice is that my aerobic capacity improved and my
Improved.
heart health
Yeah.
improved
Hmm.
significantly. So that was encouraging. It didn't improve during the 2 million steps. I was stressed.
Yeah, sure.
Like that was, there's a point of diminishing returns when it comes to some of this fitness stuff that we do. I
Hmm.
do think that I reached that point, particularly because I wasn't sleeping enough, right? I was
Right.
getting maybe 6 hours of sleep at night, and that was partly just that's all I could get based on
Yeah. Yeah,
what I was
I'm
doing.
I'm I'm right there with you, and that's in the season of life that we're in here in this household right now with a second newborn. That's about all the
Yeah,
sleep I'm getting right now. Maybe 5.5 hours. My wife's probably getting even worse than me, but that's one of the things that I notice is my wearable devices and stuff that track the heart rate and whatnot. My resting heart rate is higher because I'm not sleeping as well. There's more stress on board. And I think the impact of that can't be understated. So, like we were talking about before, some of the factors that all together add up to why a certain subset of people will maybe deal with more preventable health related challenges than others. Stress is so impactful and not in a good way, right? It's going to negatively impact just about everything. You can be doing a lot of things that are beneficial for your health, but if the stress is out of control, it's still going to be hard to keep all of those um, conditions at bay, right?
yeah,
We know so many stories of people that from the outside looking in, right, you would think that they're very healthy, but maybe they're dealing with work related stress, family related
Mhm.
stress, and then they die of a heart attack or
Yeah,
something. And it's like you didn't even know that anything was wrong. Um, but it's all these factors sort of add up and
Mhm.
they all play a role. Um, so then what was the world record when you guys looked up what the world record in steps were in a
yeah,
month? What was it? And then what is it now? Is it 2 million or like what exactly is
yeah.
it now?
Yeah, so it was 1,971,278. I said it a few times, so I'm pretty sure that's it, but
Yeah.
about a little over 1.9 million steps.
Okay.
was previously. And that was set relatively recently.
Huh.
Uh, I was actually surprised that there wasn't like a mainstream, like there isn't mainstream awareness of this record because
Yeah.
that'd be a pretty cool record to kind of follow. And then honestly, we're probably going to build a lot of our brand around that record because, again, walking is just this thing that most people can do,
Right.
and can connect with. So Guinness doesn't have a record for this. I think it's part of it is because it's difficult to track and
Sure.
verify. And so my goal anyway in April of 2026 is to go after it again and live stream it and have a Guinness person following me around or have it verified in a way that it can go into the Guinness Book of World Records and then challenge somebody around the world to beat it
Yeah, that'd be pretty
and
cool.
create an experience around it. I think what I've learned the most about health education and promotion and transformation over the past year and a half is that um, most people aren't going to be motivated by you simply telling them that they need to take 7,000 or 10,000 steps a day. They need to eat like this or this and that. And honestly, if after I'm done with this work, I've created a culture of people like obsessed with tracking their health and knowing their steps and their VO2 max, and like that doesn't sound that healthy to me, right? That's not what we should spend the majority of our time thinking about as it relates to our health. But if I look outside and I see like just people moving together on a walk together or
Yeah.
sharing a healthy meal together, and it was motivated by our experience, then I'd be happy with that because ultimately, again, we're trying to create a health promoting life experience for people. We're not, we don't want health to feel like this additional chore that people have to do to be healthy. Like, how do we design their life to where it creates health? And so what we've done is created these digital experiences through challenges. So at the beginning of this year, we gave away 2 tickets to Super Bowl 59 to anyone who, or well, you were entered in for a chance to win if you completed 59,000 steps in a week, which is a little over, what was it? I think 7,000 or 8,000 steps, a
In a
day
day.
for a
Yeah.
week.
Mm-hmm.
Now, you could also get additional entries for every 1,000 steps you went past that mark. There was a girl that did 50,000 steps a day
Yep.
for 10 days. Other people doing, 30, 40, so on and so forth. And while we didn't just say, hey, go take 7,000 steps a day, we said, compete for this challenge. The outcome was that the average steps per day among everyone in that challenge was over 10,000.
Yeah.
And so, ultimately we're doing this for outcomes. So how do we design it in a way to get people to engage with it, um, and get the outcomes that we want without it feeling like a chore?
Yeah. Yeah, I think
You know?
that's so important because, as it relates to what we do, right? We our team at Physio Room, we have physical therapists, coaches, trainers, massage. Maybe the massage doesn't necessarily fall into this all the time. It kind of depends on the person's motivation to come in the office for a massage. But for sure on the training and on the physical therapy side of things, like we're asking people, our clients, to do hard things, right? Like people don't, you know, always have the motivation to want to fix the problems that they're dealing with, right? It sometimes either A has to be in a really bad place for you to feel motivated to finally do something about it, or B, you're going to come across days where you just don't want to do it, right? Or your symptoms start to get better, and then you stop doing the things that helped you start feeling better in the first place, and then all of a sudden it comes back. So I think designing it around challenges, experiences, opportunities for people instead of just saying, "Oh, you should do this because it'll make you healthier." It's like that's just not enough to motivate people, especially if that's a person that's like they're not dealing with any negative ramifications of anything. Like if they haven't
Mhm.
been living in a health promoting way, but they're not necessarily feeling any consequences of that yet, it's hard to be motivated
Yeah.
to
And,
change.
and and even so, the environment has normalized
Yeah, yeah,
disease and unhealth. And so not only are they not dealing with this, an acute issue with their health right now, even if they developed one, it's like, oh, well, my mom has that too, or my grandparents have that too. It just, I mean, I guess I got it too.
yeah,
And I do think it's like something that medical system is failing people with that language of like, predisposition to conditions because
Hmm.
most of us internalize that as like hereditary, meaning like there's not much that we can do to influence it. Because while most of the country is literate, most of us aren't health literate. And so to a doctor, predisposition doesn't mean you're guaranteed to get a condition. It means that if you live a life that, is associated with higher risk of that condition, you're more likely to develop that condition,
Yeah. So you,
right? But it doesn't mean that you're guaranteed to have it.
yeah, yeah, I think that's a good point. I think with you being the public health person, help us make sure we're all on the same page and understanding this. What does it mean to have health literacy, right? Like
Yeah,
if you say this group of people has lower health literacy, like where's the threshold? Like what does it mean to be literate from a health standpoint versus have low health literacy?
sure. Yeah, so that's actually a good question because the definition varies depending on like what, I guess, aspect of health you're dealing
Yeah,
with, right? So
sure.
there's health literacy and like what is considered healthy food, right? So
Hmm.
there's like health literacy from a knowledge perspective, or how much exercise should I be doing, or how much should I weigh, like what's a healthy BMI, right? So on and so forth, things like
Hmm.
that. So there's a knowledge aspect of health literacy, and then there's nav like being able to navigate the healthcare system. That's another form of health literacy. And that's, I think, typically the form of health literacy that most people talk about. It's like, what kind of question should I ask my provider when I go in? What does what my provider or what does any of what my provider is saying mean
Yeah.
for me, right? There's just this steep learning curve and for most of us as it relates to just understanding medical information that's communicated to us by our providers. Dr. Eric Griggs is actually probably he really has a gift for this, and that's health communication, breaking down um, health and medical information to the regular everyday person in a
Hmm.
way that we can all understand it. Look him up if you're interested in just learning how to communicate better as a physician when it comes to that stuff. So yeah, those are the two primary forms of health literacy, right? So it's like a knowledge thing, awareness of like what is considered healthy, and how do I become healthy, and then the other component is
Hmm.
navigating the healthcare system, um, and understanding how that affects your life.
Yeah. Yeah, for sure. And I think,
Mhm.
we all have different areas of expertise. And I feel like because of, what it is that you do and what it is that I do, and we're kind of like in this medical and health environment, it may be sometimes the people that we're surrounded by, maybe it feels like that the average is up here,
Mhm.
but that's not what the greater public necessarily is, right? So
No.
I get reminded of this all the time, like whether I'm working with and talking with clients or other family members in particular that like they don't work in medical or health or
Mhm.
anything like that. And I'll say something that seems like basic everyday common knowledge to me, but it's like I'm speaking a different language to them. So yeah, I think that's so important to acknowledge and realize. And we were chatting off air about how like everybody can benefit from a little bit more education on this topic and understanding how we can better promote health within ourselves, within our communities, within our families. um, what I want to maybe ask you real quick is, so the bear health app, black electronic health record, say somebody's listening to this podcast and they're hearing us have this conversation, they say, but I'm not black. So how does this apply to
Yeah.
me? How does what we're talking about apply to somebody else that might not be part of that subset of people, but the other
Yeah.
things that we're talking about resonate strongly with them, taking better care of themselves, taking better care of their families, their communities. What would you say to that?
Yeah, that's a good question, and something we're going to be wrestling with for I'm sure the life of our company.
Yeah.
Um, so we have this digital health platform that can help people generally speaking. What makes it specifically for the Black community is that's just where we focus. We
Hmm.
promote to the Black community. We partner with organizations that are serving the Black community, so on and so forth. And so the majority of the people on the platform are Black or of African descent, and so the tool itself. Is a general tool.
Yep.
And so when you download the app, you answer some questions. The health score algorithm is based on 300 million years of clinical health data that is based on global health data. So the score will be relevant to you. Your individual score will be relevant to you. Over time, we're going to be able to stratify data by city, state, zip code, partnering organization, so on and so forth, but also by race,
Hmm.
right? There will be race questions in the app as well. And so what I would say probably like at minimum for anyone that, would like to benefit from what we're building, I think particularly our challenges are around like the what we're calling the bare million steps challenge, the 1 million steps in a month to, lose on average 20 pounds, for example. Um, this is the problem that we're solving in this community. And so I think at minimum you have to support that. Not necessarily you have to in order to join. I'm saying like for you to, feel comfortable and want to, or be in this environment, you're going to have to be an ally for that on some level. And I think that's most people,
Yeah, for sure.
I don't think many people are going to be like, yes, I want health disparities to continue. I want, young kids to lose their parents at 50, and they're teenagers and now they have to grow. Like that. I think everybody would like to support that. And then also people can become educated um, about the issues more. And again, we can all just become a more integrated in a positively integrated society. The additional thing, and this is more of a technical and I guess useful thing, is that when you solve problems and design solutions for those who are struggling the most with a
Hmm.
particular issue. So obviously, Black people are doing the worst here in the country as it relates to overall health, as well as Native Americans. If we can solve this problem for Black people
Yeah,
and take the learnings that we gather from solving this problem for Black people, those learnings can scale upward,
for sure.
right? However, if we, let's say, just went about this the typical way and just followed the market, where people would most likely download our app, like say somewhere like Denver or LA, right? We could build a successful business, right? But we would only modify our tools and our messaging and curate events based on that market.
Yep.
And while that might work for that particular demographic, we wouldn't be able to scale those concepts necessarily down to the Black community that is dealing with different barriers to health.
Yep.
Right. So if we go to where there are the most barriers and solve the problem, then we can solve the problem for others, who aren't dealing with as many barriers. And so I think that's a real opportunity for everyone in our approach to solving this problem. However, I think over time, there will be two businesses here. There will be the business solving the problem of maximizing health in the Black community and reducing that life expectancy gap. But then there's the health score itself as a
Hmm.
concept that once once there's complete integration of that concept with the healthcare system. That's not the problem that I'm interested in solving. That's not the business I'm interested in building personally. But if somebody on my team comes on and takes that on, there's a really big opportunity in that for providers to be able to reliably say or be able to reliably see whether or not this patient is at significant risk for a particular condition based on this reliable health score, like a credit score for your health.
Right.
You know, again, I know that opportunity is there. I see that opportunity typically when I'm pitching investors. That's where they harp on. But again, I'm more interested in solving this particular problem. This is what makes me wake up every day and work as hard as I can. But I'm not so ignorant that I'm going to ignore the other opportunity that exists. And so, we'll find a team member to pursue that. And I can see in the future, obviously, like brands change, names change. Maybe Bear will ultimately be the platform for the Black community, but then we'll have another platform that's general, same kind of technology, so on and so forth, but it's more general and about creating a global health record, real-time health record. Um, and so, but that somebody else will do that, or once I feel like I've gotten to a point with solving the problem for the Black community, I'll move over and do that.
Yeah. Well, I like the way that you answered that, and my favorite part of your conversation there was how we're trying to solve the problem upstream, right? Like we're not trying to create solutions for people that aren't dealing with as many barriers. We want to solve the problem at the base, at the root, because how we solve that problem will apply to all those other people that are not dealing with quite as many issues, that are not dealing with as many barriers. Um, but if we did solve the problem for those people, right, the people that aren't challenged as much, aren't dealing with as much health struggles, aren't dealing with as much access issues or whatever, that's not all going to apply to the people that are. And I love that, basically what you're talking about is like we need to solve this problem farther upstream at the source. And yeah, I think, back to where we started this conversation with root cause type of an approach
Hmm.
and, addressing things from a prevention minded standpoint.
Yep.
I think it's perfect. So in
Yep.
summary, the platform is accessible and could be a beneficial tool for everybody.
Yep.
The passion and the the marketing and everything is like targeted towards that niche of people. It's the same thing with that we do at Physio Room, right? I'm not going to sit here and tell you or anyone on this listening to this show that at Physio Room we work with everybody. We
Hmm.
don't work with everybody. Could we work with a large range of people? Yeah, absolutely. We absolutely could, and we do have a large range of clients, but that's not who we say that we're the best at working with. We
Hmm.
help active adults in the Denver area um, continue to do the activities that they love, pain and injury free. And who we treat the most are runners, our weightlifters. We have a great pelvic health niche on our team. Um, Now we can still work with those other people, but that's not who we target and
Hmm. Yep.
who we say that we really help the most because we know if we just look across our clients, like those are the people who we're seeing that we're
Hmm.
really knocking it out of the park with. So
Yep.
yeah, I totally get it from
Yeah. 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 I always hope that people don't feel, I guess, uncomfortable about it or offended in any way because it's really about solving a specific problem, just
right.
like you're saying, right? And when it comes to this problem in particular, the history shows that the policies, practices, and beliefs that created these conditions, created these disparities, these were very targeted policies, practices, and beliefs, and they were very creative and they, you know, yeah, came up with different ways to execute on the same objective. And so, from an efficiency standpoint, to solve that problem quickly, we need to be equally targeted, if not
Yeah.
more, if it's impossible to be even more targeted and more creative. Because now we're dealing with long-standing residual impacts of all of that stuff. So, and much of it still exists from a, like a social climate perspective.
Hmm.
So, I mean, social media has given rise to, I mean, there are kids who are 18 years old saying crazy racist stuff, and I'm just like, on some level, I think if had social media not, become what it has become, um, the ideas would have been on their way out. I think like they were trending out. I think they're coming back just because uneducated people get access to information and but I hope that we figure it out. Um, I'm sure we'll get a lot of those kids saying crazy stuff about what we're doing.
Yeah.
But ultimately, hopefully we can have conversation.
Yeah, totally.
Yeah.
I think in response to kind of what you just said, I think so often people say things or make comments without having any context of what they're even talking about, and you'll make a comment that later on maybe you'll become educated or get some context, and then you'll look back on what you said and really regret saying that. And I think that's going to happen to a lot of people, and I think it's so easy to kind of hide behind the screen or the keyboard when it comes to social media and whatnot, or hide behind the
Yeah.
phone or whatnot, because these conversations, like you said before, where you're trying to bring community and whatnot. We live in such an isolated time with all of the technology, and having access to all this technology doesn't bring us necessarily closer together with people in real life,
Mhm.
because so much of what we're doing is over screens, over phones, computers, and stuff. So, Kwame, I know we're coming down to the wire here on our time this morning for me, afternoon for you. What have we left out in this conversation around? The bEHR Health app you guys officially launched today. We're trying to promote health for the Black community and everyone, right? We're trying to bring awareness to
Mhm.
improving health from a prevention standpoint and addressing things at the root. But what have we left out of this conversation that we want to make sure we include before we're
Yeah,
wrapped up here today?
sure. Yeah, I would say actually a few things. One is, I guess I'll start off with an event that we're hosting,
Yeah.
or a challenge, right? So at the end of my 2 million steps in April of this year, everybody kept asking me what's next, and I actually thought that was a I had just done 2 million steps in 30 days. This is literally on the last day of the challenge. Like, what's next? I'm like, I don't know. That's not something I'm thinking about. I'm going to lay down, actually. That's probably all I'm going to do. Try to do nothing. But it got me thinking because what had happened there was that people were inspired.
Yeah.
That's not something that I was thinking about going into the challenge. Again, my objective was to raise awareness for people about what we're building. Um, but there were like, countless times where I'm just walking throughout the city and someone had seen a post about what I'm doing on social media, and they would stop me and say, "Hey, are you that guy? Are you the walking guy?" Like I became the walking guy in the city. It's hilarious. And what they told me after once they found out it was me, they're like, "You are me and my friend's inspiration."
Hmm.
And inspiration is such a powerful word and a powerful experience to be inspired. And when I think about what I'm actually trying to accomplish, and what we all need more of in the world is a reason to live, a reason to grow, a reason to live more, do more, be more. Because, we've been trending in kind of like a nihilistic, meaningless direction, especially as we just stare at our screens all day. And so we need more of a reason for being. And when you look at like blue zones, right, places where people are living well into their 100s on a regular basis compared to other areas, like purpose and community are at the top of the list
Yeah.
for longevity. Before you care about what type of, diet you should eat or, what type of exercise regimen you should be on, like you need to figure that part out. And so that's really what um, I've kind of shifted my focus to is like, how do I inspire?
Hmm.
And how do I inspire others and then get others to inspire others as well? And so public health is the art and science of prolonging life. That's the definition of public health. And I've kind of added a mental health component to my definition of public health, which is now the art and science of prolonging the desire to live.
Hmm.
Because the desire to live is the root of longevity, right? I'm sure you've seen it with your patients where if they want it, they recover better. They get there, it's just like I'm sure it's night and day. And so like we really need that in order to solve this problem. And that's really the way that we want it to, that's how we want the outcome to manifest. We don't want to just keep people alive, right? And more or less immobilized and just doped up and just alive to be alive. Like we want people alive and thriving and wanting to be here and wanting to do more because of the experience that we created. And so, I mean, there's actually this 65-year-old woman on our app here in New Orleans who in August and July, or July, yeah, July and August of this year did 1 million steps back to back.
Ooh.
She did 1 million steps in 1 month. I called her and I was like, congrats. She's like, what'd I do? I was like, are you serious? You just did 1 million steps in 30 days and like you're 65 years old. Like that's incredible. And she's like, oh, okay, yeah, I love that. Like, go me or whatever
No
she
big
said. I was
deal.
just like,
Yeah.
okay. Yeah. And then she did it again the next month and she was competing with this like 35-year-old guy on the app. She ended up doing like 1.3, 1.4 million steps. And I don't know what the record is for 65 plus, but she's got to she's got to be close to it if she doesn't have it. And so my point is that like, I went on and took on this challenge and then that inspired her to just go beyond what she may have thought that she could do. And guys, we're obviously talking about like the health lane and the fitness lane right now, but there are a variety of ways that people can be inspired to do more of what they love and what's
Totally.
positive for them. And so yeah, just yeah, find purpose in something. That doesn't mean find this grand purpose per se. Like sometimes people think they have to have this giant objective for purpose in their life. Just find purpose in your life That could be a matter of just shifting your perspective and your attitude towards something that you have in your life right now, because that's going to make you healthier, so much healthier. Um, anyway, I cut off part of what I started with about started talking about the marathon. So they were asking me what's next, and I'm like, okay, well, I don't know. Well, the next couple of days while I was resting, I came up with the idea for the marathon. Since people were so excited and moved by the idea of a world record walking, I was like, well, I'm about to launch this app. What's a good way to get a bunch of people on my app at the same time? We're not just going to say download the app to know your health score because, who cares? But we're actually all going to go after a world record. So the objective of the marathon is to get 1 million people to move on a single day as a part of a walkathon, essentially.
Mm.
The current world record is 773,000 people, which is impressive,
Yeah.
right? That's so many people across multiple venues, obviously, not in one spot.
Yep.
Million people in one spot. I don't know if that's possible.
That would be pretty wild.
Um, and so the Bearathon this year, the theme is Bear Health to the Moon because it's our official launch. When I say this year, 2026, Bear Health to the Moon. And so our goal is to gather enough people on the platform to where we can cover enough distance over the course of 30 days to reach the moon
Uh-huh.
as a community. Again, the ultimate goal of the Bearathon is to get 1 million people participating and break that world record. But obviously, well, not obviously, we could hit it technically, but I don't think it's likely that we hit it this first go round. So yeah, to participate in the marathon, you download our app. The challenge is already live in the app. It'll start in April or on April 1st, right? We're gonna do this challenge similarly in April, and yeah, become a part of our movement to again close this life expectancy gap and just give each individual in our country, each individual ultimately in the world, their best chance at reaching their full potential, right? Because if you aren't all that you can be, you suffer more than you have to, and so does everyone else. And right now, mostly driven by like political issues, not everyone is given the platform to become the best version of themselves. And I'm not saying anyone is entitled to any inequality of life, right? I'm not acting like we're not in this world and all trying to figure it out together. But I think it's better for society, better for all of us if everyone is in a better position.
Hmm.
There's less crime, there are less issues when people are taken care of.
That's
And
right.
I know we have the capacity to do it. And so um yeah, that's what we're working toward. So I would just say download our app, um, complete your health score assessment, join a challenge, and yeah, let's just continue to inspire others with who we are and what we do.
Yeah, I love that. And I'm with you on inspiring, inspiration being like such a powerful word and a powerful feeling. I think that's a great challenge. If you guys are listening to this episode, I would encourage you to go download the Bear Health app. You should be able to find that in the Apple Store or the Google Play section on your phone there. And join the Bear Health to the Moon, uh,
Hmm.
challenge and be one of the people that's helping to accumulate steps to help us collectively reach that distance to reach the
Yeah.
moon. I know you're going to be putting in your part. You said you were going to go for a ton of steps in April of
Yep.
2026. But yeah, I'm excited to go do that. I'll go download it and
Perfect.
figure out
Yeah.
what my health score is. And I
Yeah.
like to kind of track and gamify things
Hmm.
a little bit. And
Yeah.
I feel like in my dad era here, I have been getting more steps anyways. A lot of stroller walks here through the
Hmm.
neighborhood with the weighted vest on and stuff. So, yeah, walking has
Love it.
become
Yeah. And
a
you,
newfound enjoyable piece of my day.
yeah. Awesome. I love that. Yeah, just to let you know, you can add also your blood pressure, cholesterol, glucose levels to the app as well, and all that goes towards your
Oh, awesome.
score. So be able to put that information in. And then
Cool.
in addition to the marathon, I really do want to challenge people to do our Bear Million challenge. If you are like dealing with weight challenges or you know someone who is, I really want to make this a thing, like the 75 hard or what have you, like the Bear Million Steps challenge. And what I want people to ponder on while they are doing 1 million steps and walking for 5 hours a day is like what makes life most worth living for them.
Mm.
So
Well, I think that's a good question. And thought-provoking question to leave people with as we kind of close things out here. Um, you guys, I really appreciate you tuning in to listen to us on this episode of The Code. Kwame, thank you so much for joining me. I thought this was a great conversation, and when we got connected a few months ago, um, I always find myself thinking about leading up to the episode, like, how are we going to structure this conversation? But what I have found is when we get people like yourself on here who are very passionate about what they're talking about, the conversation is so easy and flows so well because you're just talking about something that you're passionate about doing every single day.
Yeah.
And I know the people that listen to this show are passionate about living a healthful life, and they want that for themselves and the people around them. So I really appreciate your time. We'll share all of your guys' websites and things in the show notes. So you guys, please go ahead and check those out. Check on their site, download the app, and take the first step towards reaching those million steps.
Yep.
Cool.
Awesome. Yeah.
Well, we hope
Thanks
to
for having
catch.
me.
Yeah, absolutely. We hope to catch you guys on the next episode of The Code, and we'll see you later. Thanks so much.